You know, loss of control and helplessness is one of our greatest fears. And one thing I've heard over and over again when it comes to people who are preparing for surgery is that they actually fear the anesthesia sometimes more than the surgery. Now that's kind of logical because you are being knocked out, forcibly knocked out for a period of time, and you are going to be helpless and you're not going to remember what's happening to you. So that is kind of logical. But in truth, when it comes to most surgical operations, if you're going to have a problem, it's going to be the result of the surgery itself. You may experience pain or lack of mobility during the recovery process, and that will be actually where the trouble comes from. But in that problem we all have, that issue we all have with fear of loss of control, we tend to worry about the anesthesia more, that not knowing what's happening to you, that not knowing how long it's going to take, and your life being just completely in the hands of other people. I would also say in the hands of God, although some people may not agree with that point of view. Now, when it comes to anesthesia, it's important to know that it's practiced by trained professionals who train for years to be able to practice in the field. And it's very routine to them. Anesthesia happens all the time, everywhere. It's very routine, and problems are very rare. Can you really say that anything is 100% safe? I don't think so. We tend to forget that driving vehicles or piloting or flying vehicles is actually a very dangerous thing to do, and yet most of us do those things every day without a thought. I'd say that anesthesia or sedation is even safer than that. So let's go through what anesthesia is actually like from a patient's point of view, and hopefully if you've experienced some nervousness or fear about this issue in the past, this will help to allay your concerns a little bit. Now, before any type of surgery, let's say in this case it's day surgery, your doctor will get all kinds of health information about you. And that's very important to make sure that he's got an accurate history, that he knows illnesses and surgeries and any prescription drugs that you take and any non-prescription drugs that you take and your habits with regard to alcohol and other substances, because that will affect how you're treated and how your surgery goes. So it's important that they get a very good history on you. Then before your surgery, either ahead of time or the day of, the person who will come and administer the anesthesia will come and introduce themselves and meet with you, and they'll want to ask you some questions. And it's important to be very honest with them, because that will affect how what type of anesthetic or sedation is chosen and how you are cared for during your surgery. So it's very important to be honest with them so that they can be prepared and know what they need to do and how to take care of you. Very important. So you'll have this meeting, and then you'll come to the day of the surgery. Now, I've been put to sleep several times. I'm fine, and I'm going to tell you what it was like for me. You roll into this room on a gurney, and you'll have people there who are getting ready for the surgery. And they may tell you when they do it, they may not, but they'll administer this anesthetic drug, and it's like nothing happened. Suddenly, it's like a scene, a shift scene in a television show or a movie where you're looking at one scene and then you're looking at the other scene, and the only way that you know anything that's happened is different stuff is going on. And they're, putting away their equipment and possibly talking to you about what happened, and it was over in a split second. There's no fade out. There's no knowing that it's happening to you. There's not even any time for any fear. And I will say that when I've gone in and experienced surgery like that, I've always felt pretty calm on that operating table. I don't know if it was because of any kind of drug. I suspect not. I suspect I was just naturally calm, like, here we go, time to get it done. But it's over in a split second. You don't even know that they're giving you the drug hardly. And then you're wide awake, or at least I am, and talking to them, and it's like you just suddenly shot forward in time. And there was nothing to it. Well, that's how it's been for me. And then, of course, for the first day or so, you want to be careful, not supposed to drive, not supposed to work, and you want to take it easy. It's very important to follow those instructions, because driving under the influence of an anesthetic drug would definitely be a DUI or DWI charge, and you risk harming yourself or other people, even though you may feel perfectly normal after that first day. So it's over in a split second for me. I don't even know it's happening. I'm awake the next second and it's all over. Now, some people will come out of it a little more slowly. That second I wake up, I don't even know how long I've been lying there. It may have been an hour or so, but it seemed like a split second. But some people do come out of it more slowly. There's a friend of mine that I've accompanied with two procedures. He's single, divorced, lives alone most of the time, and so I've gone as his helper, driver, escort before, and he will wake up from it a lot slower. And when he's coming out of it, he'll act like a very drunk person and be saying all kind of things that won't make any sense. And I'll have to give some reassurance that, yeah, it's all over, everything's fine, we're back in the first room. And I may have to say the same thing over and over again, but, I understand what's going on, so I don't think anything about it. And, I'll just play along with him, and then finally, we'll get out and leave. And so it does take some people a while to come out of it, and for that reason you may want to be careful who you have with you as your helper or escort if they've never been through anything like that. But when it comes to me as a helper, I understand what's going on, so I'll humor them and it's no problem. I know what to do, know how to handle it, and no big deal. Now, it's very important after surgery to follow your doctor's instructions, because even though you may feel quite normal that first day, you could still be under the influence and not quite realize it. And so for that reason, it's important to have a good helper. Someone who will be your driver, helper, escort, and if possible, stay with you that night if you don't live in the same home. In the case of my friend, I have stayed overnight with him that night, and to the next day to make sure everything's okay. And that's just to make sure that everything's okay. You may feel perfectly normal, you may feel like you can do anything, but just to be on the safe side, it is best to take it easy for the first 24 hours or so and act as if you are incapacitated to an extent, even if you feel well. Now, I'll never forget, he was feeling so good after one time. I was going to stay overnight and help him out for a while, and so I decided it was time to cook dinner. And then I was back at the stove cooking dinner, and I said, I'll take care of all this. He says, what am I going to do? I said, well, you don't have to do anything. I got this. But he wanted to get up and do something, so he got up and helped me. And so it's important to follow those instructions, especially if it's a person who normally lives alone. It's important that they have somebody with them just in case there's any problem, just in case they were to pass out or something like that. That's not very likely, and even if it did happen, it wouldn't be serious, most likely. More likely to stumble or something like that. But, it's important that a good helper is with that person. And your helper is there with you, just to make sure that you got everything you need, just to make sure everything's okay, just to make sure there's not any problem, and there probably won't be. But it's very important to follow those instructions. Don't work, don't drive, don't do anything of the kind. Then make sure that you have a good helper. If you are the helper, then, just sort of keep an eye on the person, make sure they've got everything that they need. Just be available there to help them if there's any problem, and any problem will probably be minor. Now, when it comes to anesthesia and sedation, medical professionals tend to make a difference between what they call general anesthesia, or being totally unconscious, and what they call conscious sedation, which is not total unconsciousness. But for the patient, it makes very little difference from the patient's point of view, because in either case you're going to be helpless and immobile and not remember what was going on. So, conscious sedation, general anesthesia, it's not really a huge difference from the patient's point of view. But, the main thing If you're like most people, the vast majority of people, you're not going to have a problem with the general anesthesia or sedation. I mean, you just won't if you're like most people. Now, I understand, even though I understand what I've just explained to you, and it's always been really easy to go through the anesthesia part, even I still feel, the idea still gives me a little bit of pause, feel a little bit anxious about it, unless when I go through it, then I don't feel like there's any problem at all. But follow instructions. Give them all the information that they ask for before your surgery. Then give the anesthetist all the information they ask for before your surgery. And that person is going to be with you and monitor you for the entire situation. So, you will have help from that person. They'll be right there with you. They'll be monitoring your vital signs. And then, it's important that the person have a helper driver escort, especially if they normally live alone, so that that person can kind of hang close and make sure that everything is okay, make sure they've got everything that they need, and just be there in case there's any problem. And I've done that several times, so I know how to do it pretty well. I know how to keep confidences or anything that's told to me when they're in that intermediate state, which I don't seem to go through, but other people seem to go through it. And so when somebody's in that situation and coming out of that stuff, I don't think anything about it. I'm not the kind of person to think anything about something that is clearly not a person's fault. Doesn't bother me at all. I'm used to it. I'll answer the same question 15 times if I have to. No big deal. Just simple, pretty easy thing. And all you really got to do in most cases, I would say, is just follow the common sense about giving the good information, then following the post-operative instructions, making sure you have a good helper. And if you are a good helper, just be there, be available. Make sure that they don't have any problems. Make sure that they've got everything they need for that first 24 hours. And after the first 24 hours, they're probably going to be just fine. And they won't even know that it happened. And they'll wonder, what the hell was I worried about? That was no big deal. But really, it kind of is. It does seem, because you are being forced into an unconscious state, and you are helpless for a while, and you don't remember it for a while, and it's natural to have a little bit of fear about that. I mean, who wouldn't? Because we all worry about control and loss of control. But in the great majority of cases, if you just follow your instructions and you have a good helper, you're not going to have any problems. Most people won't. That has been my experience, and it has been the experience of other people who say, what was I worried about? That wasn't really such a big deal. And for the first 24 hours or so, it is a big deal. You don't need to be doing normal activities, and you do need to have somebody close by, but all you really got to do is just kind of take it easy. I mean, that's really most likely all you're going to have to do. Now, I hope that this has helped to ease some fear by telling you a little bit about what it's like, because that was the purpose of this. But understand this. Anybody can post anything on the internet, and they certainly do. And what you may see in response to this video are people who will claim to be a doctor or a nurse, or they claim that they've had a certain experience, and they'll put something on here just to scare you. People absolutely will do that. But what I've told you is the truth of what I've experienced. It's the truth of what other people experience, and there are plenty of other people that you can talk to about this. So with regard to people who would try to scare you, realize that they will try to do that for not very good reasons, and don't put a lot of stock in that stuff. Because I believe that what I just told you is the normative experience, the main difference between the quick recovery that I experience and the slower recovery that some other people experience. So, follow your instructions. Make sure your doctor and the anesthetist has all the information that they need, and then follow the instructions afterward. Take it easy, relax, don't work, don't drive, but if you're the helper, make sure the person doesn't do that. And I do believe in the vast majority of cases, if you do this, you'll be just fine, and you will not have had anything to worry about with that general anesthesia. So take it easy, don't worry about it.